Good evening. My name is Thomas Leist. I welcome you cordially to this year's education series sponsored by the MS program at Thomas Jefferson University. I would be remiss not to recognize the sponsors that have made available funds to make this program series possible for us. The sponsors had no influence on the content of the programs that we are going to present as part of this series. I would also like to thank the sponsors and donors that support important missions at the Multiple Sclerosis Center. One of these functions that is very important, particularly in times as the ones that we just have gone through, is our social worker that is at our center. Please keep in mind that making a social worker available is an important function. So let me start tonight's presentation and ask two questions that I will try to address in this first segment. What causes multiple sclerosis, and what role does Epstein-Barr virus play in all of this? You may have seen in the press that there has been recent research published regarding newer data obtained concerning Epstein-Barr virus. And I would like to take the opportunity to put this in context for you. So let's start out and consider who has multiple sclerosis. Not long ago, we would normally quote the number of about 400 to 450,000 individuals in the United States with multiple sclerosis. The MS Society underwent a study to better understand how many individuals in this country actually do have multiple sclerosis, and according to their counts that they published about 2 years ago, the number is closer to 1 million than it is to 500,000. Another very important fact about multiple sclerosis is obviously when it starts. Diagnosis of multiple sclerosis can occur at any age, but most often happens in a person's 20s to 40s. It is important to note that as with all autoimmune diseases, also in multiple sclerosis, there is a much higher likelihood of the condition in women than in men. So there is probably about 75% of newly diagnosed are women. About a quarter of the patients are men. So we talked about when MS is diagnosed, and I mentioned it is diagnosed in the 20s to 40s. But what is the average age of an MS patient in the United States? The average age of an MS patient in the United States is somewhere in the mid-50s to mid-60s. So what this means is that patients with MS live with the condition for quite a considerable period of time. You could ask the question, is MS a genetic disease? And we will dive into this a little bit more in the following slide. About 15% of the persons with multiple sclerosis have a first-degree relative with MS. Keep in mind that in the general population, the risk of multiple sclerosis is about 1 in 750 to 1 in 1,000. So having a 15% chance, 1 in 7 risk is obviously significantly elevated. So this does indicate that one part of multiple sclerosis is genetic, but it's only one part. It's not the whole risk trait for an individual. What about the highest potential genetic risks that a person could have? Well, the highest genetic risk would be in identical twins, because the identical twins share, to our best of our understanding, essentially the entirety of the genome. And in identical twins, about 25 to 35% of the other twin have MS if one of them has multiple sclerosis. So the first twin has MS, then the second twin has about a 1 in 3 chance of also having multiple sclerosis. Look at what happens with fraternal twins. So these are genetically not identical twins. They grew up at the same time in the womb of the mom, but here the risk goes down to about 3 to 4%, so almost tenfold lower. A person with a parent with multiple sclerosis, a child of parents with MS, you see the risks over here, it's substantially lower. And this also is important because what this means is that we don't normally check patients prospectively for MS. The only ones where we potentially would be looking are identical twins. What about environmental factors that potentially may affect multiple sclerosis? I have already pointed out that Epstein-Barr virus is one of these environmental factors, and I will come back shortly to this. Smoking is one of these environmental factors, and the risk of developing multiple sclerosis is higher in smokers than in non-smokers. So if you don't have to smoke, please don't. So let's turn to Epstein-Barr virus. This is data that has been recently presented, and we will look at this through a much broader lens to start with. So we have already discussed with each other that multiple sclerosis both has a genetic risk. So in families with multiple sclerosis or in families with autoimmune diseases, there is a higher likelihood of having multiple sclerosis. You saw this. We also know that there may be some additional genetic presentations that may be present. But as I have pointed out with, for example, smoking or with Epstein-Barr virus, there are environmental components to the risk of an individual for developing multiple sclerosis, and we don't know all of these risks. And so at the center of all of this is then obviously the multiple sclerosis. So now let's look at one of the factors that many of us, and I would say the majority of us, encounter. That's Epstein-Barr virus. Almost 94% of the population, of the adult population, is infected with Epstein-Barr virus. So it's a ubiquitous virus. As viruses go, this is a very successful one. It is a herpes virus, and the herpes virus family has a feature that combines them. Once you have the virus sticks with you for the rest of your life. The Epstein-Barr virus is easily transmitted. It's the cause of mononucleosis or glandular fever. And when a person has acquired Epstein-Barr virus, it stays silently in the body. Epstein-Barr virus has been linked to cancers, and it has been linked to autoimmunity as a risk factor for both cancers and autoimmunity. What about Epstein-Barr virus and multiple sclerosis? It's virtually certain that a person with multiple sclerosis, whether it's a pediatric patient with multiple sclerosis or an adult, has Epstein-Barr virus. And this gave rise to a study by Asherio and colleagues. They work out of Boston. What they took advantage of is they took advantage of the fact that the military collects serum samples of enlisted persons and keeps these serum samples. Such serum samples are collected when the person enlists and also is collected at stages in between. This allowed the investigators to look through a database of 10 million enlisted personnel. And among these 10 million enlisted personnel, they identified 955 that developed MS after enlistment. And for 801 of these individuals, there were actually more than blood samples over time. And this allowed the investigators to look at when the enlistees developed multiple sclerosis with respect to when, whether they were Epstein-Barr virus positive at the enlistment or whether they acquired the virus later on. So what did they find? They found that 800 of 801 enlistees developed MS and had the Epstein-Barr virus. What they could see is that some of these enlistees developed Epstein-Barr or acquired Epstein-Barr virus after they were enlisted. And what they could see is that the risk for developing MS increased after the enlistee, the soldier, had acquired Epstein-Barr virus. When did these individuals develop MS? Normally about 10 years after getting infected with the Epstein-Barr virus. Interestingly, the study also looked at whether there were other changes happening. And one of these changes is neurofilament light. Neurofilament light is a factor, and I will talk to this a little bit later on, that is shed from injured nerve cells. And it can also be measured in the serum. But what the investigators could see is that NFL levels were rising well before the person developed overt symptoms of multiple sclerosis. They could do this in a subset of the 801 patients. So let's think about how a virus like Epstein-Barr virus could potentially affect the individual. Epstein-Barr virus can infect cells of the immune system. They can infect the B cells and T cells. And with that, Epstein-Barr virus could affect these cells in a way that they would survive longer. And with that could lead to autoimmunity. Epstein-Barr virus also has the capacity to make cells survive when they should actually not survive. Think about it when you have a flu infection. Most of the anti-flu T cells and B cells disappear, and it's only memory cells that ultimately survive. And it's also possible that Epstein-Barr virus may foster an environment in which MS is more likely. by the fact that it can travel to the central nervous system. And it will be important in the future to rule or work on these different aspects. Epstein-Barr virus is interesting because it behaves differently, whether a young person, a child, is infected, or whether an adolescent is infected. In a small child, Epstein-Barr virus may cause a viral syndrome, and you wouldn't even know that the child has a problem. It's just cranky for a day or two, and then things are over. In an adolescent or adult person, Epstein-Barr virus can cause, as I mentioned, mononucleosis, and the world knows about it. There are underlying differences how the body handles this virus at that point in time. And you see over here that in a person that gets infected as a child, very few Epstein-Barr virus positive lymphocytes, B cells and T cells are present, versus in an adult, many more of these cells are present. And so we know from the past, before the study out of the military was done, that a person that acquires Epstein-Barr virus in adolescence have a threefold increased risk to develop MS. So what does this mean? What this means is that Epstein-Barr virus is one risk factor that can affect a person's likelihood for developing multiple sclerosis. It is not the risk factor of multiple sclerosis. So Epstein-Barr virus alone does not cause multiple sclerosis. But this also means that it may be helpful to develop a vaccine against Epstein-Barr virus. Now, there are obviously two questions over here, and you know this already, for example, from shingles, which is a different kind of herpes virus. With shingles, we give patients or individuals a vaccine, Shingrix, in order to prevent reactivations of the virus. So we don't prevent the infection. What we prevent is the reactivation of the virus. The question is obviously, what would be better? Prevention of the infection or alter how the virus is handled by the body? So we don't know what causes multiple sclerosis at this point in time, but as I showed you from the genetic studies, from the environmental studies, Epstein-Barr virus and smoking, there are lifestyle factors that contribute to the genetic risk of an individual. It is likely that Epstein-Barr virus is a factor that affects a person's risk for multiple sclerosis, but as I mentioned, it is not the factor alone.